All right, so here I'm just gonna go through kind of like the approach I take when I get a client and then how I kind of orchestrate the programming and our first session or first program from there. So here's a client I had my first consult with today, and basically all this information up here you can see is basically stuff that we talked about. So he mentioned in his request that he had a previous injury. So like basically that's just what we got stuck into straight away. So I asked him what his basic injury was, and he said he's dislocated both knees on several occasions. So I was like, all right, I'll dive a little bit deeper. I'll figure out the exact way he actually injured them. So obviously hurdling, once wrestling, and one picking up the dog. So quite a lot of variety in it, which doesn't necessarily help too much with kind of narrowing down the cause of the dislocated knees, but I guess it's good just to know that specifically how he did them. Said he had a snapped MCL maybe. So you get a lot of clients that come in and they have had issues in the past and they've gone to doctors or physios and they've never actually quite found out exactly what happened, which is totally fine. It'd be better if they did find out so you know the exact like mechanism of injury and then exactly what the injury was, but you can only work with what you've got. And then I just thought, okay, so how long ago was it the first time it happened? About 5 years ago. And he also has some hip issues as well. But right here, I'm mostly focusing on that knee because the knee seems like quite the issue. So from there, I've just worked with him. I said, how bad does it get? Like what kind of exercise or situation do you ever get in where it's the worst pain, and then how bad it is? And he said running's about a 6 to a 7 out of 10 pain, and that's the worst it gets. On top of this, he gets lower back soreness, so that's mostly when he's performing lower body and leg movements. I wanted to know when he stopped playing sport because I had an inkling that he did play sport, and he stopped at 14. He's now 19 years old, so that's 5 years out of sports. And in sports you get a lot of variety in your movement, and once you stop playing that sport, it's the simple, if you don't use it you lose it. So that could have also played a factor. So I'm just trying to gather as much information really here as possible, or maybe not as much information as possible, but more so just the necessary information that's required to kind of work on the situation accordingly. So another key thing he told me here was that leg extensions, whenever he tries to do them, cause him quite a lot of grief. He can barely do the lowest weight on the leg extension. So he gets the shakes really bad, simply just from the lowest weight. So obviously from here, you'd assume that he has like some quadriceps inhibition and that whole area isn't working properly, the anterior leg and just on top of that knee. So from there, once I gather like all this kind of information, I'll then write myself like a little note at the either during in or at the end of the consult. So here I'm just talking about basically how I feel like my approach is going to be just off the bat. It's obviously going to change, but this is just off the moment that I've just recently spoken to him, so it's fresh in my mind. So here I'm thinking of doing some leg extension isometrics to help with the quadricep inhibition that you'd assume he has because he struggles with the lowest weight on the leg extensions. Thinking either a stable squat, such as a hack squat or a split squat, in a position that works for him. So a lot of people really struggle with knee pain when squatting, and a really simple way of helping them get into that squatting type pattern is just getting them to drop on the ground on one knee and get in a comfortable deep knee flexion position that they can actually bounce in and out of. So that's one of the most common ways that I try to manage performing a squatting pattern with injured or sore knees. So as I've mentioned, that split squat's probably going to be more ideal because it leaves more room for extra movement in and around the knee and the tibia and the lower leg complex. So that's a positive that we could work into. Then obviously hamstring probably needs a bit of work to help stabilize the knee, and also that proximal calf complex. So everything just above and just below the knee, it could be really beneficial just to get that nice and strong and working accordingly. So that can also help stabilize the knee too. Because a lot of people think of the knee just as like an isolated thing. However, there's so much surrounding tissue and so many surrounding areas of the body that contribute a lot to help stabilizing it. On top of this, the leg press hurts his lower back, so it's probably wise to make sure that's performed properly from the beginning for an easy, safe way to load the legs heavy, which I personally believe that the leg press is the safest way to load those legs really heavy. One, because everyone can go relatively heavy in comparison to other squatting variations they perform. And two, it's just so stable that if you perform it correctly, it's really hard to mess it up, I personally believe. So here is the first session I've kind of planned and programmed for us. It will be a 5-minute walk, just to warm up, simple warm up. And also I think it's better than a bike, just getting the legs walking and moving. You get a little bit more movement into the legs. From there, I'm thinking a leg extension isometric. And here, as you can see, it's not like a formal kind of rep range and stuff like that. So I say begin with minimal knee flexion and time, then slowly increase based off his response. The key thing is here, based off his response. So it's all according to basically how he responds and reacts to the exercise. So that's going to take a little bit of trial and error and a little bit of tinkering at the beginning. And so I've just written maybe 3 to 4 sets of 10 to 15 seconds at an RP of 8. We're going to go pretty hard on it just to see if he does have that quadriceps inhibition, and also just try to really push it and see if he can get that good burn and it's not like tendons taking over or any other part of the body taking over. So to be honest, based off what I just said, I might even do longer duration if we can, but it all depends. Like I said, he said he already struggles with the lowest weight, so it's going to be tiptoeing around that a little bit at the start, trying to find out exactly how he'll go with that. Then we've got a leg press. I've just got 3 sets of 8 to 10 at an RP of 7. And right here, we're focusing on avoiding butt wink and just trying to find the right depth. So if he's really struggling with lower back pain with the leg press, there could be numerous reasons as to why, but the most common reason is people just have their pelvis posteriorly tilting at that bottom position. Usually tends to be because they're trying to get too deep. So we're just going to find a nice depth range or range of motion that he can work in successfully without causing any pain or grief. And then we're going to load that as well. So it might not be anywhere near the range of motion that he usually performs, but we're going to make sure that it's pain-free, which is the main problem. Post that, we've got seated hamstring curls. I've got 3 sets of 10 and an RP of 7, and we're really just focusing on making sure the hamstring's working in a very stable, skill-free environment. So you're locked in that kind of hingy position in the seated hamstring curl, and there's not a lot of room for error if you're performing it correctly. So we're trying to just get into that machine and just get the hamstrings working accordingly. Then from here, I've got the incline dumbbell bench for 3 sets of 10, which is just an absolutely goated exercise, pushing, pressing variation. And then we're following that up with a lat pull down with a neutral grip bar. And we're just gonna try focus purely on getting that huge stretch in the lats and pulling those elbows down into the side of the body. I really wanna try to activate those lats. He said he's been doing lat pull downs, so let's really try to see if he is utilizing his lat muscles with that lat pull down, because a lot of things can take over. And then the final exercise for this first session is standing calf raises, 3 sets of 15 at an RP of 6 to 7. All we're trying to do is build that strength in the proximal calf and therefore hopefully help with improving that stability around the knee. And we're using high reps because obviously he probably hasn't done calf raises for quite a while, and we're just going to ease into things and get a good burn. That's ultimately the first session and probably a lot of the first program, him just getting used to these exercises. I just wanted to show you that because I just want to show an emphasis on when you're programming, a lot of people try to find like extravagant exercises and stuff that'll blow people's minds or is like really novelty. As you can see, a lot of this isn't novelty, but I have a reason for each one. So there's a why behind the what. So there's the what, all these exercises, and the why is all these explanations here. And it's really important to have a why behind a what. Whenever you program anything, you should have a reason as to why you're doing it. And it could be something as simple as like I'm doing this exercise because it's a compound leg exercise. Sweet, at least you've got a reason for doing it. But you need to have a reason, otherwise you're just blindly programming, which is probably not ideal or optimal. There's nothing optimal, but it's not as optimal as it could be. So, from there, here I've just written down like a little bit of future stuff. So this can be some progressions if we're not regressing. Here you can see the leg extension isos. I'll just end up doing a traditional leg extension or eccentric overloading, because he said he did really struggle to move that weight upwards. So let's see if we can just help him guide it upwards and then just take that weight down by himself. Leg press into that split squat variation I was talking about before. We'll get a little bit more movement into the leg and then isolate each leg individually and see if there's any faults between both legs. We could even do this before, but like I mentioned above in my why behind the what, it's probably important just to get him to do a leg press safely and well so he can actually load those legs properly. We'll go from a seated hamstring curl to a lying hamstring curl, just to get a little bit more distal hamstring with less hip flexion, but also just for a bit of variety too. Even that is a good example of a reason of a why behind a what. Just switching up, say, a type of hamstring curl for another, purely for variety, whatever. If that's the why behind the what and that's what's necessary, that's completely fine, and that simplicity is fine. So we're going here. The lat pull down, I'm gonna hopefully move into a single arm, half kneeling lat pull down. Could even just do it without the half kneeling and just sitting on a lat pull down machine, because we're really gonna try focus on getting that big stretch in the lat and then the big squeeze down. We're probably gonna try crunch into it as well. And then exercises to add, we're gonna have to obviously add a lot of core variability. Maybe he's lacking some movement variability in his core, which is translating down to the knees and the lower body. Probably unlikely, but it wouldn't hurt. And then the adductors are really important as well, which I haven't put necessarily here isolated, but I'm getting leg press there, which you will get a little bit of adductor. Down here, I'm gonna like start to isolate them in the future. So like a lateral lunge or a lateral sled drag. But yeah, that's basically how I run through the process of a client. I pick them up, I go through the consult and go through all this information here and ask them the necessary questions. Then I'll go down and write myself some notes to think about, especially while it's fresh in the mind. Then I'll create our first session, always ask myself why I'm doing the things, the why behind the what. And then usually, or sometimes I don't do this, but a lot of the time I do this, I think of progressions and ways we can continue to improve and make things more challenging and more difficult. So yeah, that's just a little insight into the way I do things. Hope you enjoy it. If you like this stuff, you can ask for more and I'll try to give out more stuff like this in the future. So thanks for watching.